continuing with the veins. Same rules apply. You will see certain veins in the first couple pictures, and then they will repeat. And I'll have the stars. If you've seen them before, you're going to see them again with the stars, basically meaning you've already seen this. It's just showing it to you again. So, the veins. As we pointed out earlier, with our heart model, in this case, unlike in our arteries, both sides coming out of, well, going into the heart are the exact same thing. So you've got the superior sagittal sinus. Where's your sagittal plane? Right here. This is actually right here, right in the middle of your head. And it actually does drain the cerebral spinal fluid that's been used. You've got the facial, again, right on your face. Can't really miss that, okay? So if it's here, it's gonna be the facial. You've got the internal and external jugular veins. You've got the subclavian, again, right below your clavicle. You've got the left brachiocephalic and the right brachiocephalic. Unlike with the brachiocephalic trunk in your arteries, both sides have the brachiocephalic. And this is actually going to be the external jugular and the internal jugular. Same like you see over here. Okay, so these drain into the superior vena cava, which drains into the heart. You've got the great cardiac vein, the one that's right in the interventricular sulcus. You've got, coming from your arm, the median cubital, the basilic, the brachial, the axillary, the cephalic, okay, all coming up and draining into the subclavian. Going down lower, here's my inferior vena cava. Here's my hepatic vein coming to my liver. Hepatic is just a very fancy way of saying liver. So if you see hepatic hepatitis, for example, it's liver. That's what it's referring to. So the hepatic vein, the splenic vein, here's your spleen. It's draining the spleen. The hepatic portal vein. See this guy right here? So if you watch Doctor Who or you watch any sci-fi, you've probably heard what a portal is. A portal is a doorway that leads from one place to another place. So the hepatic portal is actually the gateway from your intestines, where I'm absorbing all kinds of nutrients, up to your liver for processing. The thing about the food that you absorb is sometimes it needs a little bit more tweaking, and we take it to the liver for that to happen. So this hepatic portal is actually draining your intestines and bringing it up to the liver for processing. You've got the superior mesenteric. Again, it's higher than the inferior mesenteric, going to my intestines for absorption. Left common iliac, right common iliac, external iliac, external iliac, internal iliac, internal iliac. Remember, that's that butterfly wing on our hips, okay? We've got the deep femoral, the femoral, and the great saphenous, okay, that are going into the legs. Looking at the legs, here's my great saphenous. Here's my popliteal, again, behind the knee, because this is coming in front of the knee, so that's got to be behind the knee. There's the femoral, posterior tibial, anterior tibial, the fibular, and the small saphenous. Looking at basically the upper torso and the face. Where's my temporal bone? Right here. Superficial temporal vein. Where's my mandible? Here. Here's my retro behind mandibular vein. Retromandibular, right behind my mandible. There's the external jugular. Look at where this is going. Face. This is my facial vein. Where's my tongue? In here, there's the lingual vein. The superior thyroid vein. My thyroid is sitting right here in my voice box, so that makes sense. The internal jugular, right here. So here's the internal, here's the external. Okay, internal, external. Subclavian vein. There's the brachiocephalic for my right. There's the brachiocephalic for my left. Here's the cephalic vein. Axillary, look at where it's at. It's in the armpit. The azygos. So the azygos is part of the rib vertebra area. And you can see that it's got the branches there, okay? There's the basilic and the brachial, and then very, very small, but you can see just a hint of it under the heart there is the inferior vena cava. Right arm. Brachiocephalic, internal jugular, subclavian. Cephalic, brachial. The axillary. That's entirely the axillary. There's the armpit right there. Basilic, median cubital. And as you can see, nobody's new here. It's just a different viewpoint. There's the cephalic in the forearm, the basilic in the forearm. Here are my ulnar, pinky ulna. Here are my radial, thumb radius, the deep palmar arch, the superficial palmar arch, and your digital veins. Okay, so these are all veins, don't forget that. So, superior vena cava, right brachiocephalic, left brachiocephalic. That is the aortic arch, which is not a vein. Okay, so the azygos, remember I said the ribs, you can see them following the ribs right there. So this is the azygos vein that is basically draining all of these. These are those posterior intercostal veins because they're along the back of your rib cage. The accessory hemizygous vein is not this main one. It's a little bit smaller, but it is draining the left side. You've got the hemizygous vein here. Let's see, ascending lumbar. Again, the abdominal aorta, the kidney, not vein or part of the system necessarily, but here are your renal veins. And there's that inferior vena cava that would be in that area. So here's my inferior vena cava, right? There are the hepatic veins from the liver, because that big liver is usually sitting right here. There are my inferior phrenic veins. Remember, phrenic means diaphragm. There's my diaphragm. Again, not part of the system. The esophagus, the adrenal gland, the kidney. Here's my suprarenal vein that's going to my adrenal gland and draining that. Here's my left renal, my right renal. For kidney, remember renal means kidney. There are the gonadal. Okay. Now, here's my right common iliac, my left. My external iliac, my internal. External. Actually, internal would be here, and this is external here. Can't see it real well. And then the colon and the urinary bladder, which again, not part of the system, just kind of giving you landmarks so you can see where things are. So here's my liver, here are my hepatic veins. Here's my liver, there's the portal vein, carrying stuff from my intestines up here for processing. Gastric. If you see gastric in AMP, gastric automatically means stomach, okay? Cystic automatically means gallbladder. Okay, so cystic, gallbladder, gastric, stomach. So when you look here, these gastric veins that you see are touching the stomach. These gastromental veins still touching the stomach, okay? Now admitted, these are underneath and these are on top, but since they've got gastro or gastric in them, you know they're going to be touching the stomach. The splenic vein with pancreatic branches. Here's the spleen, there's the pancreas. That's it right there. The splenic veins coming in from there. The gastromental veins still here, still part of this, just extending down. This is still the same thing, okay? It's just that here we got the branches, here we've got the main vein, okay? The inferior mesenteric. Remember, mesenteric means intestine. So here's my intestine, my large intestine, and there it is. Now, superior mesenteric, okay? That's going to be small intestine plus large intestine. Okay. Legs. Inferior vena cava, that's what this is. When it splits, it becomes the common iliac. That splits and becomes the external iliac. Then we've got the deep femoral, the femoral, and the great saphenous. And these should have stars on them. Okay, so the lower leg. Anterior view, like you're looking at somebody's knee. Posterior view, like you're looking at the back of their leg. Popliteal, behind this bone from the back. The small saphenous. Anterior tibial. Here's my tibia, this is on the front. Posterior, it's in the back, okay? Anterior's in the front over here, this is in the back. Fibular, excuse me, this should be scooted over to here, but it's this one right here. In front of the fibula, that one right there. The great saphenous, more toward the medial side of your ankle, okay? The dorsal veins of the foot, this is going to be on the top of your foot, okay? Like a shark fin would be on the back. The dorsal venous arch, you can actually see the arch here. And then the digital toes. Okay.